Okay, so I hope you can hear me. I'm a bit irritated because I did the recording just now and the file was corrupted. Hence, I need to do it again. And like, I'm already tired, but like, I just want to finish this farce. So I just have to do it. So this is part 2 of the B.1.5 and I'll be doing it once again. As you already see, I have everything highlighted because I just finished my recording just now and the file went corrupted and I had to read once more. Okay, so let's just get over with it. So first question, walking barefoot in contaminated area most probably is parasitic infection. The reason why it's not tediapitis is because it is usually associated with sweaty socks, usually like sweaty feet, and schistosomiasis is usually a water parasite. So and the rest is doesn't correlate it well. Okay, question number 2. So bilateral interstitial infiltration acid fast bacilli positive is usually or Mycobacterium tuberculosis. The keyword here is acid fast. There's only nocardia and Mycobacterium tuberculosis which is acid fast here. And the more typical pneumonia is M tuberculosis. Question number 3. Some appearance and discharge pass intermittently is usually a nocardia species symptom. So hence it is nocardia species and actinomyces israeli can also have some appearance. However, it is not as like common as in nocardia. Question number 4. So if it is actinomyces, it usually have a characteristic sulfur granule in pus. So that's the characteristic of actinomyces infection. However, it can also form a sinus and draining tracts, but it is not specific to actinomyces infection. Okay, question number 5. So question number 5 is history of intravenous drug in an emergency department, and like there's absent option in for gram positive cocci, and hence it is probably an immunocompromised patient. Hence it is a pseudomonas infection, and pseudomonas in an aerobic gram negative bacilli. Okay, question number 6. So this person have both the symptom of respiratory and gastrointestinal, and this person also have a steroid use. So as I told you that steroid use always answer strong gylidosis or stercoralis. Yes, or strong gyloides stercoralis. Yeah. So question number 7. So the immunoglobulin which can pass the placenta is IgG. Just remember it. Question number 8. Potassium hydroxide is a fungi investigation. So and it reveals a spaghetti and meatball, which is the character of Malassezia fungi, which is the cause of the disease called pityriasis vesicular, and it causes a hyperpigmentation macula. So the answer is pityriasis vesicular. If you hear any disturbance, I'm very sorry. Okay, so question number 9. A thick white vaginal discharge, itching and irritation, and with yeast cell with budding. So it's a candida, like candidiasis, because candida usually present with milky white discharge of the vagina, as well as it have a budding cells. And the reason why it is not on trichomoniasis is because it's usually associated with strawberry cervix, as well as yellow or greenish discharge, and bacterial vaginosis is usually have clue cells. So those are the keywords of it. Question number 10. So barefoot walking is probably parasitic infection over other type of infection. Question number 11. So homemade alcohol, just remember that homemade alcohol is usually a methanol poisoning, because methanol are normally and are most reported case in homemade alcohol case. And if you want to remember in advance, so ethanol, isopropyl, and acetaminophen, all of this type of toxicity is a metabolic acidosis without increase in anion gap. Why methanol poisoning have an increase in anion gap? Okay, so question number 12. So Plasmodium falciparum malaria. So it can cause a brain damage, hence it can cause coma. Question number 13. So this patient is undergoing a TB medication. This patient use isoniazid. So isoniazid usually interrupted metabolism of vitamin B6, hence it causes a vitamin B6 deficiency and cause a peripheral neuropathy, and hence the answer is peripheral neuropathy in this case. Red urine is the side effect of rifampin, and ocular toxicity is the side effect of ethambutol, and liver toxicity and rash are not specific to any medication. Like lots of medication have this side effect. Question number 14. So this patient have a swollen mass in jaw as well as a sinus tract drainage pass from the area. So the answer is probably actinomyces israeli, because it causes a lumpy jaw disease as well as its form a sinus tract for draining the pus. Staphylococcus aureus can cause a jaw disease as well. However, it doesn't form a sinus tract for draining a pus. Okay, so this question is wrong, because the gene therapy for allopurinol is actually HLA-B.1.5. So there's not this choice here, so all the choices are wrong. Just remember that allopurinol is HLA-B.5.8. So this question, so as I told you, are swimming in contaminated water is always a Neisseria fowleri. Okay, so question number 3. So if the question have something like hard to culture, very hard to find organism, stain doesn't come, like nothing in the stain, it always a chlamydia trichomatis. Just remember it, like it's very hard to culture. Question number 4. Oh my god, I explained this so long and I had to re-record it. Okay, so mother with Rh negative and boy with and son with like Rh positive. So it's something called Rh incompatibility, and like this disease is called hemolytic disease of the newborn, or it also called erythroblastosis fetalis. It normally causes in second child because the mother need to form an antibody against an Rh positive first. So if the first child is Rh positive, then the mother will form an Rh positive antibody, and hence when the second child is Rh positive, the antibody attack the second child, and hence it is a type 2 hypersensitivity reaction. I just go very fast. I'm very tired, very irritating that I have to record once more. Okay, so question number 5. So Sibley scale infiltration of TH17 and TH1. So what is the therapy for this? So the therapy is blockade of IL-17A, because IL-17A is a pro-inflammatory cytokine, as well as IL-17A is associated with keratinocyte proliferation, which causes a severe scale. Hence, blocking it would treat the disease, which is psoriasis. Okay, so G6PD deficiency is an X-linked recessive disease. Just remember that. Okay, so for this question, it is for pap smear to preserve the specimen. 95% ethanol is used because it maintains cell morphology and prevent degradation, and the rest doesn't do the work as good as 95% ethanol. Okay, so APC gene is a tumor suppressor gene, and hence its function is inhibition of cell proliferation. Okay, so question number 9. So HER2, as the name suggests, human epidermal growth factor receptor 2. So its function is probably amplification of epithelial growth factor signaling. It's just by the name gave the function of it. Okay, so question number 10. So this person have a sexual contact, and it cultivates gram-negative diplococci, which is probably Neisseria gonorrhea, because it's most commonly associated with sexual contact, and it is also a gram-negative diplococci. Pseudomonas can be, but it usually associated with an immunocompromised patient. And Streptococcus species are gram-positive. Staphylococcus aureus is gram-positive, and hence it doesn't associate with the question, and hence the best answer is Neisseria gonorrhea. Okay, so for the last part, so this the tube used here is sodium fluoride. So as you know, sodium fluoride is associated with glucose. So yeah, so the glucose would be different between the two samples. And for the coagulogram, so coagulogram use a tube which is a blue tube, and it is used a sodium citrate. Okay, so for this question, so if you see the picture, it's certainly a herpes simplex virus because the rest doesn't look like this. It's just a remembering of the picture. And question number 4 is watery diarrhea and vomiting, redness around peripheral area, and this child seemed dehydrated. So the most typical of this case is rotavirus infection. Okay, so question number 5, like muscle spasm and like rigidity kind of symptom. You can go like read by yourself. Like the person cannot move his jaws. So like after reading all the 4 choices, the best choice is probably exotoxin mediated inhibition of neurotransmitter release. So that is probably the best answer. So question number 6, long-term corticosteroid use, even if you don't know what the picture is probably strongyloides stercoralis. Okay, consuming raw pork, it can be both tinea or trichinosis. However, if you see the picture and if you remember the picture, and tinea are more commonly prone to raw pork consumption. So it's the best answer is probably tinniasis. For this question, so not wearing shoes and like see this condition is probably not muscle pain, not athlete foot, not cellulitis, is probably anemia. So the last choice is anemia, but if there's a 5th choice of like lava migraine, it's probably be a better answer. But since there's a 4th choice, so the last choice is anemia, which is left like after cutting all the choices. So question number 9, so after seeing the picture, I don't know what it is, but it's probably gram-positive due to it being red by staining from the safranin, and or it is cocci species, and hence the 2 choice is Neisseria gonorrhea or Moraxella catarrhalis, and I think Neisseria gonorrhea is more typical. So that's the reason why I choose Neisseria gonorrhea. Okay, so for question number 10, so auditory stimuli failure as well as presence of cataracts and murmur of cardiac auscultation. So it is the typical symptom of congenital rubella symptom. Okay, so question 11, persistent fatigue, sore throat, swollen lymph node, night sweat, low-grade fever, enlarged tonsil and exudate, and palpable cervical. So or you see the picture, this is Downy cells. So Downy cell is associated with EBV, Eastern Bear Virus, which is usually transmitted to saliva or most commonly kissing. And after cutting all the choice, it's probably fecal oral transmission. Okay, so question number 12, negative result. So the cultivation showed no result. So it's, as I told you, it's probably chlamydia trachomatis in this case. Okay, so next question is painless ulcer. So painless ulcer is a cancre, is most commonly associated with syphilis. So hence the pathogen which causes syphilis is Treponadium pallidum. Yeah, so it's probably the best answer here. Okay, so question number 14 is swollen erythematous and tender, and there's a gas within the tissue, hence is a gas forming bacteria. If you don't even know what the picture is, gas forming bacteria, the only option here is Clostridium perfringens. Okay, so without reading the question, if you see the picture, you know it's eschar, and eschar is caused by a family called Rickettsia, and Orantia suzukamoshi is a Rickettsia, hence it is the answer. Okay, so question number 16. Okay, so a wedge-shaped lesion of the heart is caused by embolism, and embolism causes ischemic infarction. That's it. Okay, so question number 17. A sore throat, a fever, preorbital, pre-peripheral edema, hematuria, and proteinuria. So it is a symptom of a disease called post-streptococcal glomerulonephritis, which is caused by Streptococcus pyogenes and which is normally called strep throat. So after the strep throat is over, it causes post-streptococcal glomerulonephrosis, which cause hematuria and proteinuria. Hence, the best investigation, there are three best investigation for this. First is ASO titer, second is anti-NAD, third is anti-DNase B, and hence anti-DNase B is in this choice, so it's probably the best answer. But if there is ASO as an option, I would answer as ASO titer because it is a better answer and a better investigation. Okay, so question number 18. So granulomatous inflammation, which means it is a chronic infection and hence it is more associated with monocyte. Okay, and this question number 19, the patient have rice watery diarrhea. Rice watery diarrhea is a typical like description of a disease called cholera or cholera, and it is caused by the bacteria Vibrio cholerae, and it is associated with CAMP, which does something with bicarbonate and cause an different in osmotic gradient and cause an osmosis, hence it causes a diarrhea. So yeah, just remember it. And okay, so question number 20, a patient have old petechiae and swollen gums, dental problems, so it's probably associated with vitamin C because vitamin C deficiency cause a disease called scurvy, which is associated with gums. Okay, so question 21. So MRSA, what's the process for it? So MRSA is a methicillin resistant Staphylococcus aureus. So it is a strain of Staphylococcus aureus which is resistant to all the beta-lactam drugs. So for this question, I'm not really sure what is the answer, but for me the most probably is gene transfer because there's a gene coded for beta-lactam resistant and hence it is for bacteria herd like or resistant community to resist against this antibiotic. Gene transfer is the best answer in my opinion. However, adaptation or genetic drift may also be correct. So it depends on what is your reasoning. But for me, it's gene transfer. So question 22. So Barrett esophagus. So what type of change has occurred? So if you don't know, Barrett esophagus is a change in epithelium of esophagus to the epithelium of intestine. So intestine normally have a simple columnar epithelium. So as I told you, a change in the type of epithelium is a process called metaplasia. Okay, so 23. For this question, after reading all the symptom and everything, I don't know what's the disease. I don't know the risk factor. So my guess is all the risk factor can be blamed through smoking. So I'm gonna answer smoking in this case. However, substance abuse may also be a correct answer, but for the safer sake of answering, my safe bet is smoking. Okay, so for question number 24, so a patient have a Clostridium tetani. So Clostridium tetani, as you know, it causes a spasm, hence answer should be inhibition of inhibitory interneuron, because if you inhibit the inhibitory interneuron, then that means there are no inhibition and hence you will keep on spasm. Okay, for question number 25, to store in refrigerator if it is unable to use, it usually is a urine analysis, like the most common answer here. Okay, so question number 26, patient have sore throat, hematuria, and rheumatic fever, and hence, and as I told you, is caused by a Streptococcus pyogenes. It can cause both rheumatic fever, it can cause post-streptococcal glomerulonephritis, and the best investigation for is, as I told you, among the three best investigation, ASO titer. If it is in the option, always answer is. Hence, I answer ASO titer. Okay, and hence it's the end for my answering. Sorry for going fast, but I already did record it once and am very irritating and tired that I have to do it once again, basically twice now. and hence or I did not explain like as good as I did in the first time, because my first recording I explained it so perfectly. But like right now I'm so tired, so I didn't explain it as nice as my first time, so I'm very sorry for it. Okay, so that's the end for this B.1.5 part, and I see you in the next time in other subject. Okay, so bye, see ya.